Cervical instability. Cervical instability is a condition in which there is excessive mobility of the vertebrae. It is characterized by dysfunction of single or individual segments of the neck, accompanied by pain syndrome in the neck, muscle spasm, dizziness, and headache. So strong headache. Instability of the cervical region accelerates the progression of osteochondrosis and can cause arthrosis of the intervertebral joints. It is important not to trigger the pathology and to start treatment at the first symptoms. The most mobile part of the spinal column, which is responsible for turning and tilting the head in the cervical region. Its vertebrae are small in size and more flexible than in other departments. So they are not strong enough and are easily subject to instability. This vertebral motor segment, SCR, consists of 7 vertebrae surrounded by muscle tissue. 1, 2, 3, 4, 5, 6, and 7. 7 vertebrae surrounded by muscle tissue, ligaments, and joints which are connected to each other in a single chain. The thoracic section, part consists of 12 vertebrae, and the lumbar of our spine consists of from 5. The instability of cervical vertebrae is accompanied by an increase in the amplitude of their movement due to a change in the physiological ratio between them. This causes the vertebra to a shift of 3 or 4 millimeters backwards or forwards is considered a pathology. Treatment. Next question is treatment. Treatment of instability of the cervical vertebra are going in hospital. Most often increases mobility in the cervical region is the result of injuries, falls, lifting weights in more than 75% of cases. Other cases of this pathology include progressive osteochondrosis. Its main reason for osteochondrosis: age-related deformation of bone and connective tissue, pathologies of bones tissue, osteoporosis, osteomyelitis, osteogenesis, hernias, fistulas, and others. Anomalies of the development of intervertebral discs, hypertrophy and decreases muscle tone, hereditary pathologies of the ligament and joint apparatus causing its weakness, postoperative complications with incorrect rehabilitation tactics, congenital disorders, prolonged physical activity associated with excessive load of the spine. We must to tell about small treatment plan of cervical instability of spine. Message is relaxing spasmodic muscle contractions and reduce pain syndrome, as well as to reduce compression of arteries and nerve roots. It is important to know that amateur message will not work. You need the help of a qualified massage therapist doctor who has the right techniques. Osteopathy and manual therapy provides symptomatic relief to temporarily stabilize the vertebra. It is used as an auxiliary method because it is short-lived, small, and does not eliminate the causes. It's not the later reason for this trouble. Physical therapy and swimming in the pool help to deal with the cause that caused the instability of the cervical vertebra. A specialty selected set of exercises strengthens the muscles of the neck, stabilizing the vertebra. Course of completion of the program is preferred, and only under the guidance of an experienced instructor, doctor, or nurse. Wearing a chance collar is designed to develop the habit of keeping the neck in a physiologically correct position, where it no more than 2 hours a day to avoid atrophy of the cervical vertebra. Physiotherapy procedures include heating, galvanization, magnetotherapy, phono and electrophoresis, electrical stimulation, paraffin and laser therapy, inductotherapy. Physiotherapy is aimed at improving the blood supply of the cervical spine, which is intended to enhance the effect of massage sessions and physical therapy loads. Drug therapy is symptomatic and includes muscle relaxants to eliminate muscle spasms, non-steroidal anti-inflammatory drugs reduce pain, vascular drugs for hypertension and headaches improve cerebral circulation. Surgical intervention are not usual, and we must to tell that surgical intervention is performed in severe cases when instability in the neck poses a threat of narrowing of the vertebral space and pressure of the vertebra on the spinal cord structures. So we must to tell next things about surgical interventions. Wanted to tell you that to stabilize the vertebra, spondylolisthesis, anterior, posterior, or combinate on 360 degrees. Depends on the degree of instability and the number of segments. Is most often performed patient. On the basis of the approach in the attachment of the plate to the vertebra, the installation of screws in the vertebral bodies, which will reduce or eliminate the subluxation, reducing the pressure on the nerve roots, as well as the replacement of the vertebral bodies if necessary. The operation is complex, so it is carried out in the clinic, in the hospital, by high-class neurosurgeries specialists who have experience in this field of neurosurgery.